Hi, my name is Dan O'Halloran, and my IT strategy is interoperability, allowing the physicians to access the universal electronic medical record. This is my prototype, and in the prototype I'm going to be showing you each screen and what the physician is going to be seeing. The first screen that we have here is the username and password. This is going to be very specific to the physician. Each physician is going to have their own username and password so that we know which physician is going to be accessing the medical record. I've seen in patient portals before that there is like a 3 or 4 page disclaimer, the policy and the terms and conditions. So this is just a portion of the terms and conditions that I had initiated so far. The disclaimer is basically saying that if you have unauthorized access to this website, to please not use it, and that you're responsible for erasing it. The policies and terms and conditions would also be need to be accepted before moving on. The next screen would be basically the like the setup page. We have the technical support, changing of the passwords, and setup of security questions. The security questions are going to be similar to what you do in a bank, of making sure that the physician is actually the physician that's using the portal before you get into somebody's patient record. The whole idea here is to allow for the physician to get into a patient record, electronic medical record, and also be able to upload and download into the system so that we can have a large database of information that the physician can access for the patient. So we would have to choose a patient's name and date of birth. So this is going to be accessing the specific patient. I've spoken with medical records before, and there are different programs that are out there. Programs that say that the physician can access all the patients all at once. But this program is going to be specific towards only the specific patient. So we're going to need to put down some identifying information to find out which patient that the physician is going to need. Patient name and date of birth, possible medical record. I also thought about making like a medical record, such as the number or even a passcode that the patient can give you. But then if the patient was unconscious, then we would not be able to access that information. Next page would be, what is the physician's relation to the patient? This will basically be the continuation of care of the HIPAA record to say that you do have permission, that the physician does have permission for access to the patient care. So the relationship would include the facility, the outpatient services, and the primary care physicians. Then you get into all the subjects. You're getting into the diagnosis, procedures, labs, x-rays, the medications, physical therapy, occupational therapy, speech therapy, history and physical, and surgeries. These are just some of the things that are being downloaded onto the system, and it's going to stay there. So even when you keep on uploading more information, the previous information still remains there. And so you're going to have a good medical history throughout the years, and could go on for several years, depending on how big your database is going to be. Next, you can also provide demographic information, immunizations, current medications, allergies, the height and weight, and also the provider information. So that how are you going to contact the provider? How are you going to, who is the provider? Who's the primary care provider? And also other lists of information such as who the facilities are, what facilities this patient has gone to, what medications they've used in the past, what are the current medications. So this system would need to be upgraded every time that there is a visit, a doctor's visit, or a hospital visit. The next screen would be basically messages and follow-up recommendations. This is for the physician to make the recommendations and also any messages to the primary care physician as to what the recommended follow-ups are and what is the next recommendations, the next procedures that need to happen, how often the follow-up needs to take place. This screen here would allow both uploading and downloading information, uploading of information to allow them to provide it into the system, put it into the database, and downloading the information to see, put into the medical record. Obviously, when you're downloading, you're going to have to download it into a PDF file and you're going to have to put it into your own system. The facility has to put it into their system to see what they've also generated as well, what they've noticed, and what information and documentation that the physicians have used in their recommendation for treatment and diagnoses. So I tried to use my prototype on several different areas. The hospital was very helpful, but they were just not helpful in putting it on camera. So this is where my delay was. So I went up to the emergency physicians, and their responses were that in a basic code where the emergent situation is trying to get the patient breathing or heart started again, they're not going to stop and look at the medical record. They're just going to do their procedures, save the life if they could, and then gather the information later as to what went wrong and what was the reason for this. The medical records response saying that they've done many different programs in the past, but many of them have failed. The physicians that already that were connected to the facilities had access to our portal system, and the portal system had access to every patient that had come into the hospital. The physicians that were not connected to the hospital were kind of lost and were not able to gather any information at all. The hospitalist responses was that they thought that this was a good idea, that they can download and upload information and gather information for their diagnoses and put into their history and physical. The administration's response is that they had noticed that other physicians in the area, primary care physicians, were not able to access the information. They were not able to access facility information, what had happened within the facility, and the recommendations. So the administration was very pleased to see this prototype and wanted to be able to enact it for all primary care physicians and download it into primary care physicians. The medical records department says that the primary care physicians must request the medical record. At this point, it would be in the system, and then there would not be any need for any faxing or request of information, that the primary care physicians can go into the system and be able to access it at any time. Thank you very much, and this is the end of my prototype.